The Arizona Medical Association's Member Spotlight Series is generously sponsored by Abe Huerta from BOK Financial. Whether you are purchasing your first residence or transitioning into your next home, BOK Financial is committed to supporting you throughout your mortgage experience. Our physician loan program provides enhanced flexibility and premium benefits not typically available through conventional or jumbo financing options. Eligible clients may secure 0% down payment up to $1.5 million, 5% down payment up to $1.75 million, 10% down payment up to $2 million, or 15% down payment up to $2.25 million, all lender-paid private mortgage insurance. Additional program advantages include discounted rates, float-down options, flexible qualification guidelines, a 0.125% rate reduction with a BOKF account, and ACH autopay, and no processing and underwriting fees on future refinances or purchases. Our program is only applicable to primary residences, one-unit single-family homes, detached and attached, agency-eligible condos, and planned unit developments. BOK Financial is a trademark of BOKF N.A., member FDIC, equal housing lender. Copyright 2026 BOKF N.A. and MLS number 403501. All loans are subject to credit approval.
My name is Chisom Okuagu. I am a third-year family medicine resident at the University of Arizona College of Medicine Phoenix Family Medicine Residency Program. So why medicine? Why family medicine? Both of my parents, they are Nigerian immigrants, and I think that kind of centers the influence of just culture and ambition and the importance of success, keeping in mind their story or travel to the United States to want a better life for them and their kids. But my mom's a nurse and my dad's a pharmacist, and it was kind of instilled like you are going to be a doctor. And I don't know how they got it right, because sometimes it's like you make these suggestions and it may or may not happen for the kids, and that's okay. But fortunately for them, I really actually enjoyed medicine. I enjoyed anatomy, I enjoyed human physiology, biology, all my science classes. And so that was sort of my intro to the medicine and the medical sphere. Shifting into family medicine came with personal experiences, challenges with familial health challenges, both here in the US and in Nigeria. But seeing the results of what the lack of quality care, what the lack of primary care had resulted in. So for me, it was instilling the influence of this is the relevance of having a really good, trusted relationship with a healthcare provider before the sequelae of things that go wrong. And it was really my family medicine rotation in medical school that solidified this is where I want to be. So prior to starting medical school, I taught special education in New Orleans, specifically in the Ninth Ward, the lower Ninth Ward, which was primarily affected by Hurricane Katrina in 2005. And honestly, that has shaped a lot of the community. Going into that community, I didn't have a lot of knowledge about New Orleans. Really special education, really teaching. I just was a fresh college graduate looking for a job that was not medicine before inevitably going back into medicine. When I entered the classroom, I was really met by a lot of different challenges. I think the intimidation, I would say the intimidation of going into a classroom as a 21-year-old leading, right, 5 teaching assistants or paraprofessionals is what we call them, in a classroom with the spectrum of students with disabilities, some more severe than others, some verbal, some nonverbal, was really intimidating. But what I found was the most helpful for me was humility. I don't know if that's cliche, but I really felt like in order for me to truly lead the classroom, it required me to not only, take my lessons and teach and, work together with this multidisciplinary classroom, but it also required for me to sit back and actually listen and actually observe and see, like, okay, the student tends to do a little bit better when the classroom's quieter or the lights are a little dimmer. And like truly just observing while also listening and hearing, you know, what is needed, why there are behaviors that are occurring the way they are. And I feel like it was at that juncture that I was able to get better leadership in the classroom. That humility has definitely followed me into my clinic room, into my exam rooms. I'm listening to my patients. I'm coming to them with evidence-based medicine and education and their best interest in mind. But in order for me to really meet my patients where they're at, I have to understand where they're willing to either compromise or, you know, what is the obstacle in them taking their medication? Why aren't they getting to their visits on time? That humility really has resulted in a lot of trusted relationships with my patients. If I weren't practicing medicine, I would probably be an astronomer. I loved and still love galaxies, stars, like astronomy, anything astronomy. I don't know, when you have like random visitors in the classroom in elementary school, like I think we had like a reptile guy come in one time and just random stuff, but there was one time where they had brought in literally like an inflatable like immersive experience where you go into this igloo type of dome and it's projected like the entire galaxy across the ceiling. It was the coolest thing that I had seen up until that point. And I really thought, like, if this medicine thing doesn't work out, I might have to join NASA. Not that it's any easier, but I really think astronomy is super cool.